All right, everybody. Thanks for joining in this afternoon. First thing you do is what we'll do is we'll approve the agenda for today. The only item on the agenda is emergency management discussion. I'd like to have a motion to approve the agenda.
So moved.
And,
Second.
Okay, a motion and a second. All those in favor say aye.
Aye.
Okay, motion carries. The conversation today is going to be emergency management, about everything is in play that you have questions on. There are also some things in your email for Monday's meeting, possibly on the new act that the Families First Coronavirus Response Act. Courtney has put her imprints on that, and if I did talk to John, and if we would like for us to send it to him, he would look at it. But he said Courtney will probably do a pretty good job with it, so he wasn't too concerned about it. But he would look at it and add anything or subtract anything he thought was appropriate. So that will probably be on maybe Monday's agenda, but I'm not opposed to talking about it today. So we have a rough idea. We just won't take any motions on that today. Second of all, I'm going to kind of turn this over to Sarah and let her get us started with some stats. And of course, you guys all seen the email that we received and on our ambulance department, which is quite concerning to me. And I'll turn it over to Sarah, and we can bring that part into the conversation also.
I invited Sarah Schulte from Public Health
Perfect.
to come because I've been having conversations with Carrie and Jason. Hi, Jason, in the basement. Kind of pulling this all together. So one question, because Sarah already knows this, she's getting temped right now. So I will send out, where's the camera? Over here? Okay. I will send this out in email. This just came this afternoon. It is the Iowa, that RNCC map that they're talking about, the regional medical, I forget what's the middle C? Coordination centers. So regional medical coordination centers. We are in what they are calling Region 1. So it is, Rich has got the copy, it is 25 counties in that bottom quadrant, and then all the little green boxes that are inside the boxes are all the hospitals. So she sent out another email just this afternoon. I will let Sarah weigh in on this too. Did you see that email? From which one? From Lynn Royer. And the email basically, I know that everybody wants constant information, and I'm trying to give out as many information as possible. But the email was very specific, and it said that we were not to send this type of information outside of the, right here. It says, per IDPH, the attached documents are for internal healthcare coalition core membership partners only, EMA, EMS, public health, hospital use only. These documents cannot be shared outside the official use only with those partners. The entities providing data have agreed to sharing this data under these specific restrictions. So if you clicked on the second image, it had all of the counties listed in our RMCC, which are those 25 counties. And then it had all of the ventilators available. It had all of the patient counts. So there's no names, there's no anything, but it's numbers. So I do feel like that's really good data that they're gonna start giving us, especially since we're grouped into those counties. But I'm reading that I can't forward that email beyond those 4 agencies, because she put that on the top. But I'll certainly send out the map, and then it's just gonna be like situational awareness for all of us that says, this is how many ventilators are hard, this is how many patients are currently in the hospitals within that region. Does that make sense? She announced on the press conference today that it looked like statewide, there were 1,751 ventilators statewide. So to me, that's positive. I had not known that number before. She announced that today. And then within our region, we're supposed to share medical assets and stuff within that region of those 25 counties. So we are with Polk and we are with Story County, when you look at that map, but maybe that's not a bad thing, so,
That might be better than we think.
yeah.
Right.
So then we don't really have an agenda. The biggest thing that we're gonna work on today is the PPE. Jason had mentioned that we should just brush up a little bit on the NIMS. So, all 5 supervisors, how comfortable are all of you on your NIMS knowledge, your National Incident Management System knowledge? Sarah's new too.
Yes, I don't know much.
Have you taken the basic classes of the 100 and the 700?
Yes.
Okay, so Sarah has taken that. Otherwise, that's your homework for the weekend. Pingree is very familiar with that. Jason is familiar, Carrie familiar, Daryl got all of his NIMS classes in. Just because it's gonna get to the point where we should at least go to the first level of the NIMS, and I'll send that out as well. Jason, chime in anytime. So the first level of the NIMS would be that we identify, and I think that we've identified already, that the county is operating under a unified command with the hospital, public health, and emergency management, along with EMS, all sharing that information together and then pushing it out. So I don't feel at this time that we need to have per se an incident commander, because it's kind of, the information is coming from the 4 different entities, so I would put us in a unified command structure. We identified that public health is our public information officer. She's the one with the information first, and then we're filtering all that information out, and then each entity is kind of sending out the communication to who they need to send the communication out to. We're both working on different information out to the schools and the different cities and the different agencies like that, so I think we got that covered. It leaves the next 4 sections, which are the 4 most important sections when you start any sort of disaster like this. So we got the finance and the administration section, which I have been talking about. The county needs to make decisions, and the county needs to know where we're at fiscally and financially on the budget. So my recommendation would maybe be to have Courtney have her name in that little square as the finance administration section chief. And then there's the logistics section, and that's gonna be the person that's really gonna start working on the orders and the resources and the developing of kind of everything that's going on. I've kind of pulled Carrie Kersey, that's why she's here today, into helping me, because it's gonna be a huge process to try to gather and collect and constantly try to find this PPE, as it was thrown at me and just said, well, we're gonna deem that everybody needs this PPE, call your emergency management coordinator. Carrie and I have been working on this almost all day, and it's quite daunting, so.
So Sarah, this is Jason.
Yeah.
To jump in on the logistics section chief, just kind of as a review for everybody, that person is the one that's responsible for making sure that they're procuring resources. Right now, the resources needed are PPE. Somewhere down the line, those resources could change, could be personnel, could be any number of things, but that's kind of the role of that logistics section, is to get and coordinate the movement of resources.
So then there's the planning section is the status of the reports, manages the planning process, produces it's called the incident action plan or the situation report, or kind of pulling all of that together and then pushing that information out, which I'm close to having our first one done. I was hoping to have it done last week, and boom, 5 days already went past me, and it's not there yet, but it's really close. And then, so they say operations chief. So Jason thinks I'm trying to do all of them at once, which I'm kind of, yes, doing, but I've been pulling people in as need be. Hence, I know that this PPE thing is a huge thing. I kind of already made the board aware with Courtney and Jean to know the finances. Jason just suggested today that we might, moving forward from this day forward, at least have 4 people in place and just know that we're starting that NIM structure with the basics of operations, planning, logistics, and finance. So you guys wanna put names on that, or just so that everybody knows we've kind of got these 4 things covered, so.
We need to start right there at that process, get those done.
And I mean, anybody who's, yay, give me a job, please, count me in. So, and Sarah's kind of in the gray area because she's Carroll County Public Health, but she works under St. Anthony Regional Hospital. But she too is responsible for the entire county of the population of the people like we are, so.
Okay.
I don't know if she's kind of operations because she is
Can I see?
the first person, and I don't know if I'm trying to move the planning along constantly. You guys are like, what next? What should we talk about next? What should we be working on next as a board? So, Jason?
Yeah, I don't know about, we batted around a lot of things about the operations section chief, but I guess my recommendation would be, it'd be somebody in the healthcare or EMS field somewhere that helps to manage that. And, who that specific person is, I don't know, but that would be my recommendation, being this is really a health emergency at this point. The operations section chief should be healthcare related.
And is the hospital saying, are they input lines? Are they assigning people to specific titles at this point? And then you're already in their NIM structure.
I don't know that for sure. I would have to talk to Sarah
Okay.
both and see what she's doing.
But again, the hospital might have theirs,
Right.
and then
Can you serve,
on
and do you
ours.
have time? That's my next question, is do you have time to serve in both capacities?
I mean, yeah, I think so. If I would be in that same operation role in the hospital, it's the same thing, just disseminated to two people.
I think the common knowledge would probably be quite advantageous to us too,
And I think
to have
she's
you in
already-
both roles,
Right.
rather
And
than
we're trying to,
relay.
Yes.
I want to work with like St. Anthony and McFarland, Family Specialty, Manning Hospital. We're all.
So I feel like she's already kind of doing the entire operational picture with pulling, because she's the first one that would know the information, and then we're just building on that, and then we have the next pieces of the puzzle with being the county.
And I would like to add, once these have been identified, this doesn't mean that this person has to do that job alone. They can bring in other people that'll be, deputy section chiefs that would, they could hand off. Right now it's probably fine. We're kind of in the hurry up and wait stage, the planning stage. If incidents if infections rise and we start to have attacks on the health system and this thing escalates, then, you might even have handoffs every 12 hours between a section chief and a deputy section chief or something that fills that role. It's hard to say where it's going. I just think it would be wise to get the baseline for this in place now and to start thinking about it. I think too, the documentation of having done this stuff is also going to be beneficial if and when there's reimbursement money available, so that we have the NIMS documentation, because they'll tie your funding to the NIMS documentation to make sure, did you do all that stuff, so that you can get the funding and reimbursement from FEMA or whoever.
So we don't have to do anything on that now, but we just wanted to bring that up and to make sure everybody on the board has at least taken their NIMS 100. It's a Google search. NIMS 100 and 700 are your 2 minimums. And it just explains all of that in a nutshell. It's very dry, it's very boring, but as Jason stated, we all should be operating under the National Incident Management System when a disaster of any sort happens, so.
100 and 700?
They're different classes.
Okay. Very good. You guys get all that? The NIMS 100 and 700?
More correctly, it would be ICS 100 and ICS 700 is how you'll find the classes under the FEMA website.
Hey, Gene, I see you want to say something. Turn on your mic.
Click the red.
Yeah, I got to get used to this thing. Yeah.
That's fine. That's fine.
If you've taken this before, do you have to do anything different, Sarah?
No, just as long as you're aware of when we say, logistics or planning or ICS, you just know what we're talking about.
I'm not sure what levels I've gotten, but I've had taken this, and I think there's probably only 2 of us supervisors that probably have taken. And that might be Neil and myself. I think one time we went through this whole exercise, everybody be doing this, and I think since then it kind of got put on the back burner.
If they
But
don't,
that should be something that's done every time somebody gets on the board.
yep, a newly elected person, so.
Have you done it, Dean? Dean, I can't hear you. You're on mute.
Turn your mic on, Dean.
It's possible that I have done it. I guess I'd have to see the documentation to see if it's familiar, see if I'm familiar with it.
Well, Courtney, do you have that documentation up to a file?
I have no idea. I'd have to look.
I think I've got mine here, I think, but I'm not sure. But it probably wouldn't hurt for you if you get a chance to maybe look, see if there's a file up there with, I thought that one time we did that all, but I might be wrong.
And just because you've taken it before, guys, doesn't mean you can't go through that online class.
Familiarize yourself again. Yeah.
It is kind of dry and it's boring, but you know, you could always go through it and review it again just so that it's fresh in your mind.
But Jason, you're going to have somebody poke you every 5 minutes and wake you up.
Trust me, I know. They're not exciting, that's for sure.
No, they're not.
Okay, so then we can either say, yep, you like my names of the people I threw out just to get an initial setup of how we're operating in that structure, or you can table that till Monday, so.
Okay. Who else did you have?
I had Courtney as the finance officer,
Okay.
so then she'll just know, because we'll have to do that public assistance funding, especially if we're gonna start buying PPE for several different agencies. Her department is assigned to start helping out with all of that.
Okay.
And then I have Carrie as logistics.
Carrie.
She's very, very good at this. She just is. Anybody can help her though, Daryl.
Sarah, you were not sure for part of your talk. Are you going to email that to us or the references to us that we can look it over?
Yep, that sheet, I just printed it off and then I can send that in an email. And then I just have that Sarah's basically running this operation. She's Carroll County Public Health. So we're getting a lot of that operational stuff from her or needs that she would want us to do.
And you run the
And
plan.
I'm basically.
Okay, that'll be fine. Thank you.
Yeah, I think that having Sarah doing that would be, and she's public health is fine. But you're also having her be the public information officer too, right?
Unified
Unified
command
group.
structure.
Yeah, I mean, we're all kind of doing a little bit of that public information officer stuff right now, but if you're gonna throw a title on someone, we are all sharing her message first, so. They have someone at Public Health, Sarah Skinner, who's actually been doing a lot of the Facebook posts and and she went to some social media training and some of the public information, so they've got somebody assigned with that, so. I mean, we could technically say public information officer is Sarah Skinner, if you want a different name to a box.
Public health as the PIO.
Okay. Does anybody have any interest in jumping in and helping out someplace here along the way?
Well, I think that we're going to have these people kind of coordinate things. And if they ask us that we all we're all gonna have to jump in at some point in time.
Daryl is willing to help Carrie a little bit here.
Yeah, we've already been including him
Okay.
in various things. So then, Daryl typed up a list of, a supply list, and it's very similar.
Tyler, go.
You already got one.
It's very similar to what everybody is asking for. Everybody wants the disposable gowns that they put on and they turn off. They're usually yellow. Several people are asking for this N95 masks. The face shields are those plastic guards with the blue thing on the top. Gloves, hand sanitizer, disinfectant. When we met Stephanie, 2 weeks ago, your dad said that the Oxaver TV was plenty in stock, lots, and now there's none. So in 2 weeks short of time, the Oxaver TV isn't to be bought in Carroll at Carroll Cleaning Supply right now. So that's on the list. Tyvek suits. Daryl too would like some more non-contact. Got a request for that. Carrie just trying to find 4 for our own county. We're 2 weeks into that and have our 3rd one that arrived today. With basically EMS being in the front line of this coming down the road, if several people would be calling in and then requesting the transport services, disposable cot covers, which would make sense, possible pampers for his people, and then the UV lights, and then Daryl can embellish more on what exactly the UV lights are doing for us. I know several counties are buying what they call a transport ventilator. It's say you have a patient between them picking them up in Lanesboro per se and getting them to the hospital, you're using a ventilator as the in-between for EMS, and then just some new filters. So Jason asked me today what some of the counties are doing with the NIMS, and I told him that the bigger counties have an EOC set up. We are not to that point. All of us can handle what we're doing in offices. But the Potawatomi, about an hour ago, we got a new letter from the state of Iowa. So I had gotten that state of Iowa message that said, we need all direct care patients, people working with them to have the PPE. Well, now they came out with a new letter. Did you see the updated letter? It states that they can only ask for the PPE after their local option to buy is out. So when they announced it, there was really no, the sky's the limit, just ask Sarah for PPE, she can get you whatever you need. That was not true, so they revised their letter. There's a new letter that just came out, I can send that to you guys that say, if this, then this, then this. So Potawatomi County, they had just sent this out, so I printed this, and then I'm going to send this out. It basically says, and this is a message that I'll be sending out to the nursing homes, law enforcement, anybody asking for PPE. This goes back to Jason saying to start using the NIMS. This is on a NIMS document. Basic criteria for requesting resources through your emergency operations center. You've not been able to procure the resources on your own, and you're not able to receive the resource through your inter-facility resource sharing attempts. So there was no guidance, it was just contact the county, and then it was kind of like, the county's gonna buy all this stuff, and they're just gonna hand it all out. That's not how it's gonna work. It's only those items that they're not able to buy. Priorities is gonna be the direct patient care for potential or confirmed COVID patients, direct patient care for hospitalized long-term care shelter populations, and then the public safety operations. PPE available, they sent this out as well because I'm getting requests for stuff that wasn't even on the state asset list. Gowns, that's the #1 request I'm having right now. Gloves, the procedure mask, surgical mask, it's not the N95, just the basic surgical mask. N95s, the face shields, must be the font caps, I don't even know what that is. Booties, I'm assuming the hair caps. Yeah. And the hand sanitizer. They created a schedule for making the PPE orders, which I do believe that we need to do this. So we have a schedule so that I'm not, okay, I just ordered a batch and then somebody else said, hey, we want in on that order. Well, I'm sorry, the next day for the schedule. So they're saying that on Fridays, they'll have these groups order to make a request by close of operation on Thursday. On Mondays, they're gonna have the long-term care, the unaffiliated clinics, the jail, the Southwest Iowa JDC, whatever that is. And then on Wednesdays, they're gonna put orders in for the home and community-based home assistance, disability, and mental health providers that support direct patient care. So, I like this because it's a bigger county that's then sharing how they're doing this, and this is exactly what I was asking from the state on Wednesday. Where's the guidance on who we're gonna give this to? And they can basically ask me for anything, and then the county has to purchase it and give it out. So this just came out, so I printed that. I can update it with our stuff, but these are the types of parameters that we need to kind of set, or everybody just thinks, oh, I'm just gonna call this number and I'm gonna go and pick up 1,000 masks from Sarah. So
I can understand why we're doing it this way, but it appears to me that we're pitting one group against another to buy. And it just drives the cost up.
yeah,
But I don't have a good solution around it. So, because I'm not sure that we want to get in the business of buying for everybody and then doling it out, because I don't know what we would get,
well, we don't even know what we're gonna be able to get.
first of all.
And then we can, so it's what can we buy, what can we try to get from the state, and then how we're gonna hand it out.
Correct.
Which is why we still need to talk about the homemade gowns and the
Right, because
other resources coming in as well, because that might be what we get down to.
what I was thinking, and I'll just throw this out on the gowns, if we can make them work, I was looking at maybe moving them to the nursing home facilities because they have washers and dryers, they can be reused. Where at the ambulance crew side, or the throwaways are much easier for us to deal with. And that was the only thing that I think that we might be able to use those for. And I don't know that yet without seeing them. So.
And who pays for this equipment you order?
So there has to be a funding stream. So then Carroll County would be, we have to have some sort of spending capacity, order the stuff, and we've got to, like Jason said, we gotta keep track of everything, fill out the public assistance, and then Carroll County would be reimbursed 85% back. So there would be some out of pocket by $100,000 for the stuff, which wouldn't take long to spend on this. Carroll County will be out to $15,000.
Kara, I was just going to mention too, I almost wonder if the ICS 213RR or should be given to anybody requesting PPE, make them fill that out and provide that back to you.
Yeah, that was with this. I just didn't want to overwhelm them with that.
Okay, I was just thinking out loud as you were talking about it. So, okay, good.
There's an actual incident command form and that's the number he's referencing, so.
So let me ask this, let's go back to the money side. What kind of dollars are you talking about? We need to.
So Daryl we buy a lot of stuff from two companies, More Medical Equipment and who's the other one?
Bound Tree.
So the other problem we're gonna run into is if we have not been customers of some place, we don't get to become customers of a new place. The supply companies are supplying their customers and not adding new, and Stephanie and her dad have seen that with the cleaning supply company. So we're gonna focus heavily on the previous suppliers that we've bought things from and try to see what we can start getting our hands on, or at least we're gonna have to be looking constantly, oh, there's some back in stock, okay, let's hurry up and try to get 2 boxes or 5 boxes or.
As of right before I came up here on that top, gowns, N95, face shield, gloves, sanitizers, and Tyvek suits. The only thing we could get out of that whole mess is small gloves. Everything else is out of stock. No idea when it's coming. So, and I don't need small gloves.
Now, so then what we're gonna do is we're gonna have a baseline for what the items cost. Because I'm getting emails, Jill Arp is getting emails, are you getting emails that say, we are a company that's in the United States, we're now selling this, you know, contact us for shipping out today. So there's these pop-up companies that are making the stuff, but I think as quickly as they make it, then the inventory goes out. So you really have to jump as quickly as somebody has it.
You gotta be pretty nimble on your feet if you want to make that work.
But this is why we gotta have the spending ability, a credit card, to be able to pull the trigger as soon as stuff becomes available.
Okay, let me ask this question before we go too much further. Do you want to assign a dollar amount today? Do you want to see this list? Do you want me just to read off the highlights? So you can make a decision.
So I'll give you some prices.
Oh, Don't forget you gotta unmute.
A surgical mask should cost around $1. Does that sound about right, Carroll?
Yeah.
95 cents to $1. And people, they do in stock. So, I mean, if we find a company and they have $1.25, it's not like we're paying $10 for something. We're gonna kind of make a price list for us to compare pricing to, and then we just have to have the authority to be able to pull the trigger and buy it. And N95 masks, they're a couple months ago, you could buy them for around $2 a piece. So they are saying they can see them anywhere from $3.50 to $5 a piece. So there's not gonna be price gouging going on. There's gonna be an increase in price, but they're not gonna have the price gouging going on. So there's two prices of that. My husband does this in Marion County. He just bought $5,300 worth of N95 masks and surgical masks. Daryl has on his sheet the PAPRs. So the PAPRs on this website that had them today, Ding's Fire Company, they're $1,230. Daryl had them on his list for $1,290. Something like this, Daryl, reusable several times, the $1,200 PAPRs.
But you're looking at a dozen of them.
Yep.
Possibly. So we're talking over 10 grand there easily.
And 12 grand.
12 grand.
Gloves, counties are buying up gloves as fast as they can, $500 at a time. I looked, I know Martin Brothers has gloves, so we can't stall on this because everybody now is doing this. So everybody is scrambling to.
Ventilator, he has ventilators on here. They're about $10,000 a piece. They're kind of requesting two of them. These are the high dollar ones. The PAPRs would be about $13,000 total. The thermometers, and those are all $500 to $700. So I can see right now that we're pushing anywhere from 60 to 100. And so I'm guessing at $100,000 at this the first time
But that's just one department.
would just get us through this page. So keep that in mind.
And I mean, if we are able to get those supplies in, we're able to resell them to places. So how the state is basically setting this up, they don't want 150 agencies from each county ordering this. They're wanting counties to do bulk ordering and then be the distribution point. So just like Rich said, the counties aren't going to be hoarding this. It's supposed to be a coordinated event, coordinated effort with each county working with their people to get the supplies and pass them out.
The UV lights like we've already got. We've got one at the station, we got one at the hospital. They're $500 a throw for what we have right now.
So
So when we're talking about this, Sarah, we're talking about for Carroll County, correct?
For Carroll County,
We're
yes.
not talking about sharing with the region.
No,
So when we're talking about ventilators, where are the ventilators gonna go?
so those are transport ventilators, those are not ventilators. Ventilators you can't even buy, and they're like $50,000 a piece. And that's something that the state is working on for the hospitals. This would just be a transport ventilator for.
All right,
And it can be used as a ventilator too.
That was my
in
next
hospital.
question. You
Okay.
could pull it out
You
of the
can
unit.
pull it
and-
out and
And
use
use
it.
it if you needed to.
Generally, what we do is intubated patients, we use it on, but it is good enough that it could be used in the hospital if they get short.
Now, also, this is $100,000 that could set out there for a year. You know how the government works.
but eventually it is reimbursable, correct, Sarah?
These supplies are reimbursable at the 85% rate.
Okay,
So Daryl has never had these supplies, never had this money in his budget. So this is an opportunity, I mean, the ventilators are going to last beyond this event. And if they, like they're saying, this is gonna come back around in the fall, if we can get our hands on this now, Daryl's going to have supplies at basically 15% of the cost because we're purchasing during this event. That makes sense.
If you sell off the supplies you're ordering, we'll pay for them up front, but the entity would be buying them from us.
They can. Yep. And several entities that I talked to said, that's no problem, you can get it, we're willing to pay for it, we can't get it. Now, if we get the state resources, that, we can't sell those. So we would have to just have an equalized or how we're gonna prioritize who gets those, but like the state resources could stay for the hospital, the public health, the EMS. And then the other, if we start getting in excess of the resources, they would go to that next level of agencies that just got added to our portfolio.
So is there a cost to these state resources?
No,
Okay. I guess, Sarah, one thing that kind of bothers me a little bit, you're talking about these pop-up companies and stuff. I'd be a little concerned about who we order and give money to when we don't have the inventory in our hands because of a lot of these situations that are going on, these hackers and stuff going on. I think there's a lot of crap that's going to be popping up here that we're going to have to worry about.
exactly. That's why we got Courtney here. She's the finance administrator.
Yeah.
She got her name in that box.
Yeah, but I don't have any money to work with.
I know, and she has nothing to
I
work
mean, we
with.
obviously didn't budget to be spending $2,000 on gloves and masks.
Right. No, I don't think anybody's seen it
And I
coming.
don't think I can just spend it. I
No.
think I need to get a budget amendment done.
So the budget amendment will have to happen. Let's just stay zeroed in on that so we can get this solved. You guys got any questions about on this piece of paper that we're looking at? We're trying to get you as much to you as we can. It's spendy, but we've got to do this. I'm guessing that we're going to have to do a budget amendment. We're probably going to have to pull it from somewhere. The logical place is probably pull it out of lost and put it back. That's the slickest that I can think of. I don't know.
Rich, can you do me a favor real quick and take a picture with your phone, screenshot that and send it to me?
I can do it.
Yeah, it's kind of hard to decide what we're doing and we don't see those documents.
And we don't have prices on here because.
That's okay.
Well, there's some prices. I got it done, Rich.
Got it?
Thanks, Sarah.
There are some things that, like Carrie has come in after lunch. She's like, there's no prices here. We gotta be a customer. So then I had Daryl working on it for 2 hours. I was pulling some receipts that other people had bought. We were going through our files. I mean, when they just throw this at you, like.
Yep.
We need the spending authority, we need the prices, we need the it's hard to throw this together in 24 hours.
Well, I think it's important to have the funding available. I don't know if we want to act like like the federal government and wait and have to wait, have our EMS and county public health wait for dollars. I think it's important that we go ahead with this, and so that they can have the green light to spend if they have to. This PPE is not going to be around forever for everybody. So if they've got an opportunity, I think there are safeguards, like Gene said. I think you want to be careful, who you're doing business with. But I guess I think I'm okay with going forward.
We're gonna work with the hospital too, because maybe the hospital is allowed to order more too, but then they sell it to us. And then it's this whole distribution thing, because Sarah was getting her PPE from the hospital. Some of the stuff that we had previously bought for EMS, we had a bill from the hospital medical supply group. So it's kind of, we have to see where we can maximize some of the purchases. And if the hospital is still able to get some of this stuff, she purchases it, we're gonna buy it, and then we're gonna pass it back out.
Well, I agree with what Dean's saying. We need to have the money there and do this, and we need the products. But again, I think this whole thing is gonna probably create a little more of this hoarding situation going on. And I mean, but at the same time, I think we need to have the supplies here when it does hit. We haven't seen the worst yet to come, I don't think. Because I just seen before we got on this meeting, that in New York, the governor now went out and he's taking National Guard, going up, picking up ventilators in other parts of the state and bringing them back into New York. So that's not a situation we want neither.
Daryl,
Yeah,
obviously it shows 56 calls as the average call per week in January and February. That is without this COVID-19.
that's just the calls we had last 2 months. Yeah,
Okay.
no COVID-19's in there.
Okay.
If it hits, it'll go up.
And your inventory right now, Daryl, is not very good, right?
On gowns, it's pretty bad. N95s and gloves, we're not sitting too bad yet. We got some gloves in early, and we had a hog company donate us a few N95 masks. So we're not doing bad there right now, but gowns we're hurting bad on. Whenever we needed them, we just got them from the hospital. And that happened to change in a hurry. So,
Well, it's two people burning through the same
yeah.
entity, so it adds up fast.
So what do we need to do here today? Do you want to do that authorization of that spending, or you want to do that Monday and get a formal resolution ready for it?
I think we should have a plan, and come Monday, I think Courtney can have it put together. We need to tell her where we're gonna dig the money out of, so she can do a budget amendment by Monday. So the funds will be in there and ready to go by Tuesday.
Doesn't work that way.
Don't work that way?
No, because you have to publish notice, but
Yeah, we got to do it.
Yeah, you got to publish that.
the actual money is, yes, the actual money is there. Are we gonna get dinged when we have an audit because we maybe spent the money before you did a budget amendment? Yes, but it's a slap of the hand.
Yeah.
So if this is an emergency situation, I say, spend the money, do the budget amendment.
I'll attend the budget from the.
And I
hard.
would say, I'm sure there's guidance on when it's.
I
like
haven't
that.
said I haven't heard, or nothing's been sent to me about spending above your budgeted amount for this. Haven't seen anything.
Okay.
But
We wouldn't be the only county doing it
no,
either.
no, and I'm okay with doing that. I just need to know what fund we're gonna be spending it out of, and then when we do the amendment, and I have the amendment basically ready. So we could possibly have it done by the end of the month. But if we need to spend before that, then I guess we just need to.
We don't have to spend till we receive the product anyway, correct?
A lot of counties they just up their credit card limits
Okay.
and.
Well, I'm assuming a lot of it, any other manufacturer distribution right now, it's first come, first serve.
Yes.
Minus healthcare, obviously they're getting served first. I know Diversity, you speak of Oxyvir, they're going to a direct shipment now, so they're not even using distribution. I don't know if St. Anthony's, yeah, St. Anthony's, that's how your guys' is coming, is directly. So my recommendation would be get it ordered sooner than later.
Well, anyway, Courtney can start the process on Monday. But we've got to come up with what fund you're gonna draw it out of.
Well, the quickest one to make the movement without any big questions has always been the loss fund, because you can move those funds easier. The only other place we could do it is take it out of reserves if we have to. But that's gonna be a decision we can make too at budget time too. Or we do the budget amendment. But I think we need to get it ordered and get it done. At least this initial order. How much of this stuff do you think we're gonna order after this then, Sarah?
We are 4 weeks from the peak. So it just depends on what type of processes we're gonna put in place is Daryl using this on every single call from here on out? Is Daryl starting to use this? I know like in the nursing homes, they don't even have the supplies yet. So if they get the supplies, they're also looking for the usage guidance.
Right now, all nursing homes, they need to use eye protection and masks during any direct patient care contact. So I talked to Nick Kalis, my state epi, and he said it's fine for them right now to wear the homemade masks to try to preserve what they have, but I have nursing homes telling me they have no eye protection at all. So, I mean, it's.
Like Carrie said, can we get safety goggles?
Oh, right, that's it, and we had talked earlier, maybe they need to dig through their workshops and see what they have at home for now. But, I had also talked to Carrie about calling Trophies Plus about gowns and masks. Well, you need to provide them the material, and then they will make them. So where are we gonna find all this material? So, I don't know if that's something I'm still gonna pursue. I know there's a couple of companies making face shields that I'm going to call and try to get a bunch of face shields in to help with the nursing home problem.
How much material do they need?
Yeah, I'm not even sure. They're, especially with the mask, they're looking for elastic, and there's no elastic to be found. Everybody's taken all that, so I'm not even sure how many homemade masks are going to be able to be made without the elastic not being available.
And the list you're looking at is just Daryl. So if we're trying to spend and then bill and pass through, the spending is going to be, Daryl's got expensive stuff on the bottom, but the spending up here on the top, the masks and the surgical masks and the boot covers, that is going to be exasperated by 15 or 20 agencies up top. So it's hard to put an estimate on the spending.
Well, a lot's gonna depend on what happens here. There's no known answer to it.
No,
I think you just need to set an amount of what you're not gonna go over at this point.
Yeah.
Not to exceed X number of dollars and then revisit it in 4 weeks or whenever. At least then you can spend some of it. An amount.
I guess we can always raise that limit, as this goes forward, which we'll probably have to do if we can get the PPE. that'll be the next thing.
Exactly, and it's kind of like what we said, the state of Iowa is slated to be the last peak, and Western Iowa is slated to be the second peak after Eastern Iowa, so we seem to be in the last of the last category. And now we're scrambling to catch up. And not necessarily catch up, because a lot of the people that have already bought up the PPE have already used all the PPE too. So the bigger states that have the cases, because obviously you can go online and start looking at stuff and it can ship anywhere. They're buying it and they're using it. Yes, hoarding, but I don't know at this point who's hoarding. It seems like everybody is using.
So Sarah, do you want a motion that would fund EMA to a certain dollar amount? Is that kind of what we're looking for? Is it, Courtney, is that what how you're looking at this?
I don't think it needs to come out of my budget. It needs to come out of a budget.
You need to authorize Sarah to order these supplies
At a certain dollar amount.
not to exceed X number of dollars.
Do you want to do it twice? Do you want to do it once?
What do you mean by that, Rich?
Well, hang on a second. We'll have to do a second public hearing if we decide to take more out of there.
Correct. I'm thinking like 200,000.
You thinking doing 2 right away?
I'm just thinking that's a big enough number that we can work with it. And
Okay.
get paid 85%. With another supplier, you're gonna get 100% of your costs back.
Yes.
Right.
And hopefully, that's a big enough number that
It'll get us through.
and she doesn't have to worry about, oh, shoot, I can't order that because we're out of money, and I don't know. That's just a number.
Okay, Courtney has a very good idea. Maybe we,
I have no idea.
Maybe we-
Because if I can't buy any of his bottom stuff, that's a lot of money on the top
Yeah.
stuff.
Yeah.
So,
And even if we don't get homeowner stuff.
Courtney's kind of thinking maybe 200 right away. That's a large number, I know, but, and then I also would like to advise Sarah, once she gets to, if she spent 120 of it, she needs to let us know so we can get ahead of the curve if it keeps coming.
Well, and you guys are gonna see that every bill day.
Right.
And this will be set up with its own project.
Okay.
So you'll be able to.
Easy to
easily
track.
and see.
Well, but that's every 2 weeks, and that a lot of things could happen in 2 weeks.
yeah, but this is, I'm gonna be consulting with Daryl and Carrie this whole time, because the three of us are gonna be working on it and trying to get the best bang for our buck right now, but if we can buy something, we're gonna buy a large quantity of it, because gowns is on that list for everybody, so.
I agree with Courtney's idea, 200,000. We don't have to spend it, but at least we got the authority out there to go forward, because I think that's a good idea.
I tend to agree with Gene. We need to take it from the local option sales tax because it can be used for any legal purpose. And just because we budget that amount doesn't mean we have to spend it.
If everybody's in agreement, I'll make a motion to that effect.
I'll second that.
Go ahead, Dean.
I'll second that motion.
Okay, we have a motion and a second for $200,000 to be placed into the account that Sarah has access to spend up to that amount. All those in favor of that motion
All right,
I
and
I guess the only thing is, we're not going to have to wait until bill day to approve these expenditures, are we, Courtney? I don't know how do you do that?
Credit card,
If,
it would
yeah,
be a bill check.
if it's a credit card, it would have to be a bill day check. But like I said, we're moving these meetings up. Do you do authorization in the middle?
Well,
Or
I mean, a lot of this stuff might purchase with a credit card, assuming.
Right.
Or they, the people that we do business with now, I'm sure will invoice us just like they always have.
Right.
So,
there's a little float time in there that
Yeah, you know, you talk about the credit card. I have a credit card in my office, but it has a $1,200 limit. And a lot of them are that way. Because the county does that to protect themselves from people. But those may need to be upped.
I'm gonna say,
And we may need to use multiple
do you
departments.
know what
cards
yours
to
is?
buy-
What is yours? I did mine the same as yours.
I've only got a $1,000 limit on mine.
So mine's either 1,000 or 1,500.
Would Jason's be higher?
I don't know that he has one.
Do you
I was
have,
thinking mine was couple, wasn't it?
Yours is probably higher, yeah.
And then I've got 4 of them, and I think it's 2 on each.
So,
Okay.
we may have to make that adjustment with the company. and
yeah.
You can handle that, can you?
So, yeah, and
Okay.
I'll just call and ask what the process is for increasing mine, and obviously it'll go back down when this is all done.
And
But
we'll
if
go
you,
through as many as we can that'll set us up as a vendor.
Right.
And bill us, because that's gonna be your scamming people are gonna be, I think, your credit card only people.
Yeah.
And the people that are willing to take our tax ID number and
Right, I think
know we're
they're gonna be,
they're gonna bill us.
I feel a little more secure with
Yeah.
them, okay? But we gotta do it with, do too, but
and we can, you know, I mean, if an invoice comes in and they need to be paid right away, so it can be ordered. If we're meeting on Monday, Wednesday, and Friday, you're gonna have 3 days a week.
Yep.
To approve that.
Courtney, are your staff good with helping us invoicing other businesses if we do this pass-through thing?
Yeah, we have QuickBooks in our office and we invoice the sewer payments, so we probably just set up a new company and just invoice it through QuickBooks.
We will need help with that when we carry.
That's like the fillers I need for those ventilators that will stop this coronavirus. I just finally found one. I can't get them June 15th as soon as they'll make them. But it's the only place I can get them, so I'm gonna sign up with a company for round 2.
okay. Well, I think Courtney feels pretty comfortable and I think this will work out pretty good. You guys okay with this subject? We'll move on to something else.
That's fine. Real quick, Sarah, I'll look and see what I can do as far as, coming up with a couple of these items as far as the hand sanitizer and the Virex TV.
The state put out that they have hand sanitizer that we can request for. It'll come out in gallon jugs. But again, the last time I put in a request, I got about 25% of what my request was. So I'm gonna put in an initial request. I'll hit submit this afternoon for various agencies that contacted me today, because we didn't have a set in stone who's going, I mean,
Okay.
I don't have to pit people against each other. Everybody, the cutoff day to order this is Tuesday by 4:00, because it's usually a 2 to 3 day lead time, and then I gotta meet the National Guard and get the supplies, and I'll have to bring it back. The bigger our load is, might need some assistance with picking up the load off the National Guard truck, and then we'll have to haul it back and see what we got, and then redistribute from there.
I've got a part-time ambulance that worked just great to load a lot of
There you
stuff in.
go.
And that's always available too.
Yes.
And I can help you out, Sarah. You just gotta let me know.
So we might be looking for bottles, reusable bottles, or because they're just gonna do it in bulk of gallons.
Okay.
But yeah, you can be on the subcommittee of logistics, Stephanie.
Okay.
Put it in the box.
Sarah or Courtney, could you send copies of those documents that Sarah was
I got 'em.
talking about?
Yep,
Email them to us.
What is this called?
that's the National Incident Management Structure System, National Incident Management System. And that's the first level of the structure.
Okay.
It's their first flow chart.
So then like Emily and Joanne would go under you, and you have 2 more little boxes.
Got it.
Stephanie can go under Carrie, and
Okay. Makes sense.
Daryl can go under Carrie, but you're the chief.
No.
Thanks for showing up, Gary.
Yeah.
You win the prize. Next subject for you.
I don't really have, what else should we be working on?
I mean, the main thing is PPE. I mean, what we've got to get, because like I said, our nursing homes are already pretty much completed. I'm gonna talk to Lisa, Corey, and Mitch from and St. Anthony to see what their supply is, how much can public health buy from them before we start ordering from you guys. And I know public health, we have some money we can play with too, and I'll be trying to get what we can get to.
Carrie said that they put more money in our coalition,
That's their
Okay.
money.
so,
It's not coalition money.
okay,
It's
so
public
it's theirs, okay,
money.
for COVID-19 supplies. So the state would use more funding to that for her, because again, if she gets it, she's gotta help pass it out too. So I don't know, I mean, we talked about the communication thing this morning. I just got a message from Kemper. It was that same social distancing family message, so we just got that. So several of the superintendents are on board. I have a nursing friend who I guess went into Hy-Vee. She said that Hy-Vee was crazy with people in it, so I reached out to Walmart, and Walmart did make some changes. They've got a lot of the store blocked off now. They've got X's on the floor so that when you go to checkout, they want you standing 6 feet apart from each other. And it sounds like we're gonna need Hy-Vee and Fairway to do the same type of process to spread the people out, so.
Well, I was wondering if there was some concern, because I saw, I'm not sure, but there's so much information out there. The Iowa Medical was urging the governor to do a stay or shelter in place, that they voted for that today, so I wondered if.
But that she didn't.
No, but I was wondering, that I can't remember what the group, Iowa Medical or Iowa Association of Medical Providers or something. So people were concerned that she was going to do that, and that's why everybody was at the store. I don't know.
Yeah,
I needed a gallon of milk and went in there, and I'm like, oh.
and I think
Really?
that's,
You know,
I
I
was
went
getting
in and
those
got out.
messages too. And
Yeah.
Carrie said she was getting the messages of people
Before I
saying
go home.
that she was gonna shut it down, but we go another day and she didn't do it, so we're just,
You know-
everybody spread that message.
You
Well,
know,
and even if she does do that, the grocery store's still gonna be open.
Yes.
Right.
So that, I don't understand why.
I don't get it either.
Panic buying.
And
Limit the people that are coming in.
Yeah.
I listened to the governor's address today, and she has as many people asking her to have a public shutdown as she also has a high number of people asking not to have it. And she's using a different set of criteria, and I don't think it's going to be a political decision.
yeah, I was reading I've got a copy of the Minnesota shutdown in front of me, and it's almost what we're doing. It's a matter of terminology. And that's, I'm sorry to say, I can't figure out how people can't understand stay home. I just can't get that.
Well, and not only that, but the shops that are supposed to be closed, I can only begin to imagine the heartache that they're feeling financially.
Yes,
But I'm still getting things, so-and-so's open, so-and-so's open, why is so-and-so open and I can't be open? Or, you know, oh, now I hear the hair people are doing their hair out of their house now. So, I mean, they're still not getting it.
No.
It's just, it's a community thing.
it's sad. And do you guys have any other subjects you want to touch on? I've got a couple things for you to think about that I ran into. One of them is I talked to Zach this morning. I think Zach's on the call. He has got the heads up that the DOT will be most likely, the road use tax money will be 25% short the first quarter of their year. So keep that in mind. Now, he said there are people talking about the government might backfill it, but that may come the next stimulus plan, and we know that's not even on the table yet. So to keep that in mind. I don't know what the local option sales tax is going to look like. That's going to be obviously 2 months down, which is going to probably translate into 15%. So we're going to have some hurdles to jump over. So that's just food for thought that coming down the stretch. Everything else I have, I think, is for Sarah. I want to visit with her before she leaves. You guys got any other inputs you want to put into this? These meetings, I'm gonna try to continue. If there's something of value, we're gonna do it. If not, we'll probably just abandon it, but we'll let you know.
I want to touch base a little bit on what people were saying as far as the governor's speech. We basically are shelter in place. I don't really understand why common sense can't be used and people realize just stay home. If you don't have to go out, stay home. I am disappointed in some of the actions I see around the county. I think parents need to step up and just tell their kids they need to stay home. I don't care if they just can't be doing what they're doing. There's a lot of gatherings, you know, there's a lot of text messages that are going out and I get them and I get phone calls. Our elderlies can't go to the store because it's overwhelmed by people. I do think people need to start using common sense, and it is not a matter of if, it's when. And it's, you know, I also disagree with some of the things that are said right now about just protecting our vulnerable people. If you watch the news, this is affecting 30, 40, and 50-year-olds as well now. And there was a 6-week-old baby that has passed from the coronavirus. So it's affecting more people than what initially thought. So I just hope people use common sense, stay home, and listen to what everybody's saying.
We just voted to spend $200,000 on PPE. If that's not waking people up, that we're spending taxpayer dollars on PPE to protect our most vulnerable workers and our most vulnerable patients, the people in the nursing home and the long-term care. So $200,000, and that might not even touch 2 weeks. We might be going to 500,000. We might be going to 800,000 of PPE equipment, because when the spread comes, we may not even have enough. And then we start losing people that had no protection.
Sarah, I know you and I talked about, and maybe people just don't see the power of this yet because we have no cases here. But I don't want it to have to turn to that where we have a ton of cases and then people finally wake up and be like, oh, now I need to stay home.
Well, there's still 8 pending.
That would be bad.
Oh, by the way, Daryl will be working at home for a while. So if you want to call him, you have to call him on his cell phone. If you have any, want to visit with him about anything. Like, we should have him set up Dalton's got him set up pretty good for that.
In regards to these electronic meetings, hearings, they're okay, but are we providing a means for the public to participate by phone or electronically?
Yeah, electronically, and Dalton is watching the input over here, and he will tell us at the end if there's anybody that wants to make a comment.
Okay, I just didn't know for sure if this was a public participation was permitted, and it is required even though we're having these meetings electronically. Thank you.
The supervisor's email, it's supervisors@carrollcountyiowa.org. So if you have a question before on the topics, you can send one on there too.
Yeah. Did you hear that, Neil? Okay. We're doing the best we can to keep the public in. Just the way of the world right now. Okay, anything else? Dean, unmute, please.
Sarah Schulte, if you could give me a call on a Board of Health question.
Okay.
Thank you.
Okay, if not, we'll take a motion for adjournment, and we'll see you again Monday.
I'll make the motion to adjourn.
Second.
All those in favor say aye.
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 Opposed? Thanks, everybody. Try to have a good weekend.
You too.
Rich, I'll see you Monday.